Hello everyone and welcome to my channel. My name is Dr. Victoria and today we are going to be discussing on a very common childhood illness that still causes many deaths in children under the age of 5 years, especially in developing countries like Nigeria. This condition is called acute watery diarrhea, often shortened as AWD. So many parents think that diarrhea is just ordinary stooling, but when it becomes watery and frequent, it can quickly lead to a dangerous dehydration if not treated early, and this can also lead to death. So, in this video, we are going to talk about what acute watery diarrhea is, how it causes it, how it affects the body, the signs the parents must watch out for, as well as the treatment and prevention. So, what is acute watery diarrhea? Acute watery diarrhea is defined as passage of 3 or more loose stool or watery stool within 24 hours. The stool is usually very watery or is usually watery without visible blood in it. And this illness usually lasts less than 14 days. The word acute means that it's a sudden illness and it occurs over a short duration. It's common in children younger than 5 years because their immune system is still trying to develop, and because of that they are more vulnerable to infection. So for the causes of acute watery diarrhea, the majority of the cases are caused by intestinal infections, which could be as a result of viral cause, parasitic cause, or bacterial causes. But the most common cause of acute watery diarrhea is the viral cause, which is usually caused by rotavirus. So what the rotavirus do is that it gets into the body system, it damages the cell lining of the small intestine, which will now reduce the ability of the intestine to reabsorb water and nutrients into the body. So instead of nutrients to be absorbed from the intestine, it's then prevent that absorption and thereby leading to large amounts of water in the intestine, which will now come out as that watery stool. Note that there are other viruses that can cause diarrhea, but in this video, we're going to focus on the most important bullet points so that the video will not be elongated. So, rotavirus is the known commonest cause of virus that causes acute watery diarrhea in children under the age of 5 years. Then for bacterial causes, we have cholera. So cholera and E. coli infection are the two major bacteria that also cause acute watery diarrhea in children under the age of 5 years. So how the cholera acts is that this bacteria produces a toxin. It releases a toxin that stimulates the intestine to secrete massive amounts of fluid, thereby leading to profuse water in the stool, which sometimes will be described as rice water stool. So when you want to know if this is caused by a bacterial cause like cholera, you would check the color of the stool to know if it looks like rice water. Yes. So that toxin just is secreted by the cholera into the intestine. This toxin now causes accumulation of secretion of massive water in the intestine, thereby leading to profuse water in the intestine. Then for the parasitic causes like gardiasis. So this gardiasis too, this parasite affects the intestinal absorption, which will now also lead to prolonged diarrhea. So what happened in the body? Let me give you a brief pathophysiology of what happens in the body. So the pathophysiology of acute watery diarrhea, normally the intestine absorbs water, electrolytes, and nutrients from the food that you take in. So during acute watery diarrhea, the infection will cause a damage in intestinal lining, which will now lead to the intestine being unable to properly absorb water into the body. And some of the other organisms like cholera might now also secrete toxins, which will now lead to more accumulation of fluid in the intestine. So this leads to large amount of fluid and electrolytes in the stool, leading to loss of those electrolytes. which causes the electrolyte imbalance that we see in children with acute watery diarrhea, especially the severe ones. So what are the clinical signs that you're going to see? So the clinical signs and features include frequent watery stool, vomiting, fever, irritability, poor feeding, and as well as weakness. So they complain of this when they come to us in the hospital. The most serious complication is dehydration. If the child is really dehydrated, then we would now have to grade it on which type of dehydration the child is having, because sometimes some of them might just be mild, meaning that they just need to take in, replace those fluid by giving ORS, oral rehydration solution, or doing your oral rehydration therapy for them. So the signs that you're going to see for a child with dehydration, we are going to group them into the three categories that we have. So we have the mild dehydration, we have the moderate dehydration, and we have the severe dehydration. So for a child with mild dehydration, the child will have increased taste and dry lip. For moderate dehydration, the eyes are usually sunken, looks like they did not sleep well or something. Here will be like a bit depressed. Their mouth will be very dry. They will be reduced urination and they will be restless. And when you give them water, they drink it eagerly, like someone that has not drank water for years. Therefore, severe dehydration, which is a medical emergency, you see your child having any of this, please carry your child to the hospital, because that's the one I can see. So they're usually very weak or lethargic. Their eyes too will be sunken. For a child that for an infant, their frontal nails too will be sunken. Then they would have when you do a skin pinch for them, it will return very slowly, and they will have very little or no urination, as well as unable to drink. So at that phase, they can't even take in more water again. All you just need to do is to carry your child to the hospital immediately. Now, how are you going to manage this if you're at home and maybe your child has the mild dehydration or maybe slightly moderate dehydration? The main goal of this treatment is to just replace the lost fluid and electrolytes. Remember I said it's commonly caused by a virus. So if you replace those fluid, the child will likely look better or regain his or herself. So the first thing we usually do is to give the oral rehydration therapy, which is the ORS. So this ORS is like a sachet it's a sachet which contains the electrolyte the child have lost, contains the glucose, sodium, potassium, as well as all those chloride and bicarbonate. So when you are giving this child this ORS, it's more or less like you are replacing what the child has lost. So the glucose will help the intestine to absorb the sodium and water back into the system. ORS has saved millions of children worldwide. And concerning the preparation, we in Nigeria here, we usually tell them to bring a 1 liter bottle water, like something like this. Yep. Then the water is usually higher than this. So what we do is to pour the water up to this level and pour your one sachet of ORS. So anytime your child stools, you replace by giving ORS to the child. Do you understand? Well, after that, we then go to the zinc supplement. We like giving zinc to the children because it helps them with that epithelial lining healing. So it improves the intestinal healing. Remember I told you that there is a disruption on that epithelial lining, causing water to get in or not to be absorbed. So it reduces the duration of the diarrhea and the severity, as well as helping in the healing process. Then you continue to feed, because the child is using electrolytes, so the baby need a lot of food and nutrients. So if the child is sucking, you encourage to continue sucking. Now, when do you seek medical care? So parents should take the child to the hospital if the child cannot drink. You notice that the child is having persistent vomiting. You notice that there's blood in the stool. You notice that the baby is severely dehydrated with high fever, and the diarrhea has lasted more than 14 days. Please carry your child to the hospital, because at that point we need to now intervene by using the intravenous route to correct that dehydration. Now, how can you prevent dehydration? Diarrhea prevention is very important, and the key preventive measures include hand washing with soap, safe drinking water, proper food hygiene, exclusive breastfeeding for the first 6 months, proper disposal of human waste, and vaccination against the rotavirus infection, which we usually do almost everywhere in the world. So make sure you vaccinate your child as soon as possible. Acute watery diarrhea is common, but it should never be ignored. The early treatment of diarrhea with ORS and zinc and continuous feeding and early recognition of dehydration can save a child's life. If you find this video very helpful, kindly like, share with your parents and caregivers, and subscribe for more health education videos. Thank you guys.